Welcome to the Partnership Power Hour with your host, Sandra Shelson. Featuring guests, Mr. Terrence Shirley and Dr. Sonja Fuqua.
Hello, everybody. Thank you for having me. Can you hear me?
Yeah, great. Thanks.
Great. First of all, I'd like to thank you all for giving us the opportunity to spend a few minutes with you this morning to talk a little bit about us and about what we are all about and what we are attempting to do. I also like to thank my colleague and co-worker, Dr. Sonja Fuqua, and I will ask that she jump in whenever she feels is appropriate. We have kind of an open talking point, and we're just kind of talk to you a little bit about what we do. And if you have any questions, just let us know. As Sandra said, I'm the Chief Executive Officer of the Community Health Center Association of Mississippi, and some of you may not know what that is. We are a member organization of the 21 federally qualified health centers that are located across the state of Mississippi. The Federally Qualified Health Center is a 330 funded federal program that provides access to health care, all gamuts of health care, mental health, social services, dental health, pediatrics, the gamut. And we receive funding to provide those services to the medically underserved patients, people in the state of Mississippi. Those funds are used to offset expenses for patients who cannot pay. So our patients actually are looked at on a sliding fee scale, and we then apply those grant dollars to offset that expense. Now, obviously, you can imagine that those funds don't pay all the bills. So we do provide services to the Medicaid population. We provide services to people on Medicare. We provide services to people with private insurance. How does it play out in the rural areas? Well, as you know, rural health care is, Mississippi being the rural state that it is, we have chronic diseases that we've been attempting to address for decades. Health centers were founded back in 1970, and actually I have the honor and distinction of being the son of one of the founders of the original health center in the country, which is in Mound Bayou, Mississippi, which is Delta Health Center. And so I've been in this game for a long time, directly and indirectly. So this is really my passion. So if you think about the Delta, you look at the infrastructure of what is and what is not there. And we talk about access to care when we look at how can we address those underserved populations in the rural areas. The needs are great, and as the partnership has its battle with tobacco, we have our battle with trying to get expanded access to care. And we are champions of hopefully at some point we'll get Medicaid expansion, because there are a lot of people out there in the Delta who need to be receiving services. They can't receive services because they're not eligible for Medicaid. So what do we have to do? We have to advocate for the populations that we serve. We have to ensure that we can keep our doors open as well. We have 21 health centers in the state. We serve over 300,000 individual patients. So we consider ourselves the largest primary care system in the state of Mississippi. We have locations in 73 of the 82 counties in the state. We have, with those 21 locations, we actually have 190 physical sites, including school-based clinics. So one of the things that we do to address or attempt to address the rural health population is have those clinics located in schools where we know we can at least get access to children who may not have access or may not have ability to get to another location because schools are where they go that they can get. This point, I'm gonna stop for a minute and see if Dr. Fuqua wants to add something to the overview and kind of leave room for conversation as opposed to a monologue.
Thank you, Terrence. I do appreciate the introduction to the Community Health Center Association of Mississippi. And as you were talking, I did have a few light bulb moments that came up. First of all, good morning to everyone, and I do consider it an honor and a pleasure to be with you on your Power Hour phone call. As you are talking about our community health centers, the Federally Qualified Health Center program has a framework in which we apply ourselves. And one of those, and I like to call it, is a one-stop shop concept. Because we are in rural communities, I would dare say that all but 3 of our health centers are in rural communities. Only about 3 principalities can be considered urban. So we are working with a community that is uninsured and underinsured at a large extent and have difficulties with access. So with the one-stop shop concept, we have an organization, a community-based clinic, where people can get their primary health care services, and as Terrence mentioned, that means family care, dental, pediatric, women's health, etc., all kind of in one place. We have patients that will show up and actually pack a lunch because I got a day off. I had somebody that was able to bring me, and so I need to get everything that I need done while I am here. There is comprehensive health care. You look at programmatic prevention opportunities, such as diabetes prevention programs in some of our health centers. We have a WIC program, which is Women and Infants and Children. So there is nutrition and training, trying to prevent certain chronic diseases. Then you have diagnosis. We make the assessments of the patients. We can diagnose them with diabetes, high blood pressure, whatever the case may be. And so then there's education. So you're diagnosed with diabetes. There's an opportunity for diabetes self-management education. If not on site at the health center, then we can refer you to a location that has it. Also, chronic disease self-management, which may talk about hypertension of entities. And we are getting technologically astute. COVID forced us to start doing things in a different way. So there are more opportunities for telehealth as well as remote patient monitoring, and we are consistently trying to enhance those. Remote patient monitoring may be blood pressure devices that are Bluetooth activated so that your results can be sent directly to the clinic. There are also iPad devices that give education and treatment, and you can send information in to somebody remotely that can look at your numbers. And then, of course, we do treatment. A lot of our sites have on-site pharmacists, so if prescriptions are written, they can be done there. If not, there are contractual relationships with community pharmacists, so that persons can go directly from the clinic and get their prescriptions filled. As we are talking, Mr. Shirley mentioned the fact that we get federal dollars, a 330 grant, and that does not pay the bills. It only provides a percentage of the support for services that our organization, as well as our health centers, are charged with providing. Now, I realize that I'm talking and just continuing to talk. If you want to stop me and ask a question, feel free to do so.
Sonja, let me interject just for a minute. The role that we play at the association is we attempt to coordinate with all of the 21 health centers and work on their needs. And we are an advocate for them. We also work on group purchasing relationships so we can maximize those federal dollars. We do inventories, not only a physical inventory, but personnel, human resource inventory, technological inventory. And we attempt to bring all 21 together and have that system very as cohesive as it can be. Okay, Sonja, I'm sorry. Go ahead.
Hey, this is Sandra.
Yes, Sandra.
I have a question. So let's take a patient. Let's do an example. Let's walk through someone who, comes to the clinic and has a diagnosis. They may need some continuing treatment, whether it's cancer, they may need some surgery, they may need some follow-up care. Would you walk us through sort of the day in the life of, or the treatment plan for one of your clients?
Let me give you two scenarios, Sandra. First of all, I'm going to give you the day in the life of a patient that can be taken care of directly at the health center, and then let me give you the day in the life of one that may need to be referred out for specialty care. So say, for instance, I come into the health clinic, and I've had my lab drawn and what have you. They look at my A1C. My A1C is 8.9, so I'm diabetic. Okay. A lot of our health centers have diabetes educators. They may not be certified diabetes educators, which some of them are in health centers, but there are educators in the clinic. So the diagnosis of diabetes, okay, your provider naturally will make decisions on prescriptions, and you'll get an action plan on what meds you need to take. Then you can talk to a diabetes educator or an educator that is there at the clinic, and they can start the conversation with you regarding lifestyle modifications like, exercise and nutrition. If there is a diabetes self-management course in the clinic, then you will be referred to that class, and you'll come in and get that ongoing support. If not, you can be referred to a place that has it. Okay, you got a prescription for metformin. There's an on-site pharmacy, so you'll get that prescription filled prior to your leaving. So that's an example of a patient where the diagnosis, the treatment, and education can be done all on site. But say, for instance, you come in and, a female comes in and needs your preventive services, whether that be a pap smear or a mammogram. So most of our health centers cannot do a mammogram on site. We do have a couple, but most of them cannot. So you are referred out to get your mammogram. The results come back to the health center, and whatever those are then, discussed with the patient. So there's a contractual relationship with an outside entity. And then if that patient does have a negative result with their mammogram, then you have another referral system if there is to be treatment for for need for a biopsy, or if there's going to be cancer treatment or whatever the case may be. However, you are still the health center's patient. We don't give you away. We just refer you out for that particular care. Your results come back to us, and it's a collaborative relationship with the specialty organization and the health center, if that sort of answers your question.
So let's say that the results come back negative, and the patient needs to have, breast cancer surgery to have the cancer removed. Is that person sent to UNC? Is that person sent to the closest hospital? Where does that happen?
I would have to answer that question, or the health center, individual health center would have to answer that question. As Mr. Shirley mentioned, we are in 73 counties. So it would depend on where that patient is located and where the access is to the service that they need.
And the key to that access piece, is will they accept that patient based on their ability to pay?
Exactly.
Got it.
So a patient may come to university and they're 50 miles away, or they're 150 miles away. So, we have the university system, there's a system up in Tupelo, but not every principality has this system that can handle surgery for breast cancer.
Gotcha. Terrence, what is the largest challenge? Because I think you brought up the most important point, is them accepting the patient based on their ability to pay. Are y'all still helping them advocate and try to find Plan B?
Oh, absolutely. And we will continue to advocate for expanded coverage, be it through the ACA model or be it through the Medicaid model. We utilize, and we also have to grow our insured base to gain more leverage to those institutions that would accept us if we're sending somebody that's a paying patient. We need to be able to leverage that they will also take our self-pay patient.
Mm. What is the biggest need for the rural areas? You keep hearing about that we have a dearth of physicians and primary caregivers. Do y'all find that to be true?
That is absolutely true. Retention and recruitment. Matter of fact, we had a bill to die in the well, it's not dead yet. We have a bill in the legislature to get funding for retention and recruitment of providers in 4 rural areas, and that is extremely critical because we are losing our people. The older providers are retiring and leaving us, and it's real difficult getting that young provider to move into an area, particularly if they're not from that particular space. So we're looking at trying to get financial incentives to be able to help attract those providers in those particular areas.
Mm-hmm. And I'd just like to add, Sandra, that COVID did not help that situation.
No.
COVID didn't help anything.
It's supposed to be COVID if we were not.
COVID pulled back the curtain on a lot of things that people had kind of shut their eyes to. The infrastructure in the rural areas, it really pulled back. People did not have internet. So when you start talking about people do telehealth in those particular spaces, people didn't have access to the internet. People didn't have access to mass transportation. And trying to get to and from, and when they lost their jobs, they lost their vehicles, they lost homes, it made it extremely difficult for those. Now they have to choose on how they're going to survive, and getting health care is not going to be at the top of their list oftentimes.
Right. Which just makes y'all's job harder because they put it off, and then they have a bigger mess to, a lot more issues as a result of it.
And when they close the schools, we lose. Go ahead. I'm sorry.
No. Go ahead. You finish. That's good.
When they closed the schools, we also lost access to those students.
Right. Do y'all do anything with mental health? Do y'all help coordinate? Because when you talked about pulling the curtain back, that's one of the biggest things that I saw exacerbated. You mentioned losing jobs and things like that, and homeschooling your children. All of a sudden, there were all these extra stressors, and the lack of mental health services was also shown to be critical. But do y'all work with the mental health population, or do you put them into the mental health system?
Sonja, I'll
start the answer on that, Terry, and then if you want to add to it, that will be fine. First of all, Sandra, let me say one thing. You may have heard it, you may have not, but once you've seen one FQHC, you've seen one FQHC. And when I say that, I mean there are 21 organizations, so there may be 21 ways of doing things. So when you speak to what somebody does, it might not mean that everybody is doing that way because of size and infrastructure. We have some federally qualified health centers that may be a 1 or 2 site organization, and then we have one that has like 49 sites. So naturally, the infrastructure and the level of services provided will be different. Now to your question as it relates to mental health, I want to tell you that system-wide, yes, there are opportunities to address mental health. And we talk about partnerships and collaborations as it relates to that. There are only a couple of health centers that actually have a psychiatrist or psychologist on staff to address mental health. However, there are collaborative relationships and memorandums of understandings with outside providers that may be in a communal mental health system or may even be with the UMC system. I know UMC does mental health, and it can be done remotely or the patient can go in. But there are opportunities for mental health assistance. However, it is not broad enough. Our health centers struggle with addressing behavioral health, whether for adults or for children. They recognize the need, but we're not having the staff to do it on site. They have to look for those opportunities. And leads me to one of our grants. We talked about federal monies not paying the bills. We do have a grant now that's a telehealth grant, and it's with Louisiana as well as Mississippi. And the focus of the grant is a collaboration between the federally qualified health center and the Central Mississippi Health Center site. So those two will be working together for telehealth relationships to address behavioral/mental health, also with a focus on racial health equity. So we look for opportunities that not only bring in funding, but opportunities that will support some of the needs in our health centers. The negative to that is these opportunities are usually time stamped, and it's like, how do we sustain this after the 2, 3, 4, 5-year grant is gone? And so that's one of the things that we face as it relates to partnerships and grants. Terry, do you want to add anything?
No, I think you did well. Thank you.
Sandra?
So you brought up a good point, and that is kind of retention of the patient. And I'm thinking from my own personal experience with my mama. She lives out in the rural area, and I cannot get that woman to, she, like, for example, she'll go in and they'll tell her she needs an MRI. I don't know about it. And then she's like, I don't want to fool with it. How do you retain, making sure that your patients are getting the help that they need so that they are not sort of floundering and making a bad situation worse?
Well, let me speak to that, and I might be jumping around from place to place as I try to answer that. What you'll find in your health centers and what you need to have in your health centers are champions, shall we say. One thing about community health centers is that most of everybody in the community knows each other, and people actually establish relationships with their provider or with the nurse that checks them in or whatever the case may be. So what some health centers are doing are having what they call care coordinators or champions or navigators, and we are really, really, really putting community health workers to work. And these are people that try to do outreach for patients like your mom. So say she needs that MRI, and it'll be somebody who calls her and asks, well, we know you had an appointment, did you go? Or, just has a conversation and sort of encourage them to do what it is they need to do. Don't know the situation particularly in your organization where your mom is, but we are looking at more opportunities to enhance those services. Some of the health insurance programs, I'm just throwing out, just say you've heard of United Healthcare. If they are working with a fairly qualified health center, they may have a care coordinator. So if your mother were a United Healthcare patient, the outreach may actually come from a coordinator from United Healthcare. One of the programs that we started here, another federal grant with mega dollars, is even a tri-state grant with Mississippi in the lead, Louisiana and Arkansas, and it relates to COVID hesitancy. So one thing where we have difficulty with people taking advantage of vaccines or what have you, and we are utilizing community health workers back to that workforce level. Community health workers, they are out in the community, they know the people, they have that relationship, and we are utilizing them to encourage people to get their vaccine. Again, community health workers are trained to talk to people about their diabetes, about their blood pressure. They can take blood pressures and then, encourage them to get follow-up. We even have one program where we're addressing health literacy. So often people do not respond to an action plan that they have with their provider because they really don't understand it. And they might not want to tell you, I don't understand exactly what you're talking about, but we have a program that is addressing health literacy. So we look at opportunities to educate our patients so that they can understand the importance of services that are needed, and then have someone to try to help coordinate with them to see if the problem is, I don't understand, I don't want to go, I can't get there, and find out what the obstacles may be for them getting the services they need.
And Sonia, let me also add, Sandra, also in that vein, the health centers are now in relationships with these payers that are value-based care driven. And with that value-based care, they have to be able to track the patients because they have to measure the outcomes. So if your mom was a part of that system and it was happened to be in one of those payers, and we'll be introducing value-based care, not just for the insured population, but the whole practice is we have to look at them annually and see what those measures are and see how they've improved. And so if your mom missed that MRI and she came in for a visit, we would be checking that way as well.
Okay. I have two questions, and Terrence, I know that you've got to hop off shortly, but are there any efforts afoot? You mentioned the legislature and legislation that, pending or whatever. Is there any way in that regard that our listeners can be of help, certain issues that we can help push?
The biggest issue with the population that we're serving is if you think about someone, and this doesn't necessarily have to be in the rural area. If you're a male and you're 25 and you're unemployed, you're not eligible for Medicaid. And you can't even get an annual exam covered by Medicaid. So when we talk about not having Medicaid expansion, people look at, well, we need to get them to work. We need to do this. We need to do that. All the data shows that the revenue brought into the state because of Medicaid expansion outweighs any of these arguments that they have saying we should not expand Medicaid. And so I listen to the pundits and say, well, the money's going to go away in 10 years. So my counter to that is how many people, and so keep in mind, the Medicaid expansion and those types of things are designed to build your infrastructure to go forward. It's not for you to be relied on. So you're building your capacity to be able to keep going once Medicaid expansion goes away. So I ask people that have had the luxury of doing well in life and someone's family gave them an inheritance. Did they turn that inheritance down because that was a one-time infusion of wealth? No, they don't.
Oh, great point.
I like that.
So a second question, and I think, Sonja, you're probably the better one to answer this, but please, both of you. When you mentioned the health educators and that, I think, I'm a big fan of that, but how do they work in conjunction with the Department of Health educators? One thing I have found over the years with the partnership is that sometimes we've got separate funding mechanisms, but we lack in coordination so that we could get the bigger bang for our buck. Meaning, a lot of times you'll show up and there are two people doing the same thing, and that always frustrates me. So I was wondering if that is something that y'all are addressing, or if it's even a problem, if there's so much need that there's plenty to go around.
Let me say I do share your frustration. Oftentimes we are working in silos, and as you say, we're not getting the biggest bang for the buck. As it relates to the Mississippi State Department of Health, we have quite a few efforts that are in collaboration with them. In terms of just the education piece, not so much. However, we have collaborated with them on training for diabetes management education, on training for chronic disease self-management. There are opportunities, and again, you remember I talk about how you'll have programs that'll last for X number of years, and then they kind of die off the scene. We had one with the health department that was chronic disease self-management, and I think it was time limited. And we referred our patients. We had master trainers in some of our organizations. So yes, it worked really well at that particular time when money was afoot. But in the meantime, it has not been sustained in terms of relationship. Some of the individual educators in the health centers are working directly with their patients on site, but we do not have many programs where educators from the health department may be coming in to train, or there are community-based sessions for educational trainings. So I don't know if that really answers that particular question or not. But we
does.
Okay.
Yeah, it does, because I just wanted to make sure that my understanding of it was, and it is so frustrating when, and Terrence, you alluded to this too. We're such a poor state that all of these whether it's a foundation or whether it's a government grant, you cannot change Mississippi. I don't care what it is, what the situation is, in 1 or 2 years. It's got to be a long haul. And
it's generational. It's at least a generation.
Absolutely, without a doubt. And it just frustrates me when, somebody's just trying to check a box. And of course, with the federal funds, we're so, it's like a game of push and pull, depending on who's in power, which direction it's going to go. So I feel your pain. Then if you guys, each of you, could design a perfect scenario, what is it that we, what are the challenges that you face the most, other than the financial? I think we all understand that. But what is it that needs to be done that's not being done, that our listeners should be aware of, and maybe be able to help in some way at the local level?
I think the listeners now recognizing that there are 21 organizations with 190 sites that they may not have been aware of before, that provides outstanding preventive health services from birth to geriatrics, that they work with the community, local communities, and encourage those people to access the care so we can start combating these chronic diseases at an early stage, and hopefully preventing that, and tout the message that prevention is worth that pound of cure. And we need to start being able to have resources that are focused on prevention, and recognizing that that's a long-term process. It's not going to happen overnight, but the downstream effect, both financially and health-wise, is outstanding.
And I would just ditto what he has said. But if you were asking me for my wish list, and I don't know that the listeners, and of course I don't know who all they are, if you've got a billionaire on the line, I hope you're listening. For me, it would be as it relates to workforce. And the reason I say that is because a lot of what we are talking about, we're talking about sustainability with particular programs or activities, is having people to do it. A lot of our health centers have people wearing multiple hats. So if when I come to the health center, the provider is there, the provider can make the diagnosis, and I need education. If there's an educator that's there, they can provide the education. If I need to be seen by a social worker is there to help me with social determinants of health. Maybe I have trouble with transportation, or maybe I have trouble with paying for my medication. They can help me with that. If I'm smoking and they're trying to keep me from smoking, we have somebody that does tobacco cessation on site. So for me, it's I think in terms of workforce, there are roles or people who can address some of our issues, but they're not available where and when we need them. And it would really be so helpful if they were.
Oh, that's wonderful. And one other thing that we have found is to access the services that they are already entitled to. For example, with the College Hunger Initiative that we've been working on, there are a lot of students that would qualify for SNAP benefits and are absolutely unaware, as is the administration, that is available. So, that just some of that is, breaking through some of the bureaucracy and breaking through to have access to things that are already available. That knowledge is ours sometimes. So I
like that you said that is really true, and that's not the same thing as health literacy per se, but again, knowing what's available to you. I mean, I have heard things before. You hear it on the news, and I'm like, well, I didn't know that I could do that. And sometimes, we just suffer for the lack of knowledge. So, just more information, community-based information that is promoted to let people know what their rights are in terms of health care and what is available to them and where it is available.
So that's a great segue into my next question. What is how do you promote your services?
As Sonja, well, like this forum here, for one.
Right.
Mm-hmm. And we, as Sonja said, one health center is one health center. So each individual health center also has their way of promoting themselves. But we do also do a marketing campaign, and with all of the activities that we do, and we do blast, and we do flyers, and we do talks like this, and Zooms, and
YouTubing. We're YouTubing now.
We're YouTubing. That's exactly right.
Woo!
Yeah.
So, what is the way that our listeners can get? Do you have, if you're YouTubing, what is your YouTube channel? How do we get to be friends on Facebook? How do we go about doing something like that so that they can keep up?
We do have a Facebook page, and so Community Health Center Association of Mississippi, and also our website, chcams.org, and you can get information there as well.
Sharon, I have monopolized the questions, so somebody else has a question. I'm sorry, Terrence, go ahead.
No, I'm just saying, and all of our sites are located on our website.
Oh, that's right. So, Sharon, do you want to open it for questions from everyone else?
We can. We've had an awesome presentation with some valuable information. And I love what Dr. Fuqua said. We have to share this information. We have to get the word out. And this is one of the reasons why we do the Power Hour, the Partnership Power Hour, is to actually get this information out to the community. And community partners, community listeners that are on today, we encourage you, please share this information with the people in your circle so that they can understand about all the services that they provide. So at this time, if any of our listeners have a question, please star 6 yourself, and you can ask your question at this time.
Remember, if you're on your cell phone or your other phone and you have yourself on mute, you need to unmute your phone and then star 6.
I have a question. How closely are you all working with the faith-based community? Because that seems like that's going to be a way that you can actually get to many people through that.
I can pretty much guarantee you that every health center is doing health fairs with churches. We, particularly with our COVID vaccination push, all of the community health workers are pushing, getting with the faith-based organizations and working with them in their respective local communities.
And some of the educational programs I talked about, like a diabetes education class or whatever, may actually be held at a faith base. I know some of a lot of our churches have congregational health nurses who are running education classes.
Oh, that's great. Are there questions?
Do you have a list of some of your clinics that you all work with? The 21 health centers?
If you go to our website, we do.
Okay.
If you go to our website,
okay.
They're all listed, and all of the sites are listed as well.
Okay. Awesome.
And the services they provide.
And job opportunities.
Okay.
We will make sure that we post your website on our website too, so that people can, make a shortcut link.
And I think the one thing we truly just want to emphasize is that nobody is turned away because of their inability to pay.
Awesome.
One other question. I know I mentioned mental health. do y'all see a lot of dementia? If you have someone in there, how do you assess whether they need dementia care? You know what I'm saying? I mean, do y'all do any kind of screening, or is it something that a family member has to bring to your attention? I was just curious about that, because I know that is a great challenge in a lot of areas, that people don't realize that their loved one may be suffering from some form of dementia.
Sandra, as it relates to dementia, that is not an automatic screening. It is one where the family member may say, well, I've noticed this or that, or the doctor, the provider may have noticed and make a decision to do that. But that's not a check the box screening that's automatically done when a patient comes in. Now, I say that also it may be protocol once a patient reaches a certain age that they do it. Dementia is not always age limited.
Right. Any other questions from our listeners?
My name is Joyce Nunn, but it's not a question. It was some great information that was given. I've worked for federally qualified health centers for 27 plus years. And the thing of it is, we have to really get out to our community that you're getting the same quality, if not better, service when you come to a community health center as though you go into any private clinic or whatever. The services are the same. They're actually, some of them are greater, and we offer much more, actually. So it's just getting it over to our community that we are actually doing these things. And through our community health fairs, and like I say, one lady asked about the church base. We do go into the churches and do the health fairs, and we actually do classes at the churches as well, the diabetic classes and all those different things. So, I mean, and at a lower cost, like he said, whether you can pay or not, we will not turn you away. And you're going to get that same high quality of service as anybody else.
Thank you for that support. I appreciate hearing all of that.
I agree.
Any other comments or questions from our listeners? Well, I can't tell you, Terrence Shirley, how much I appreciate it. Sonja Fuqua, how much I appreciate you guys being on the call. We are going to make sure, remember, this is, will be part of our podcast series, and we are, excited to continue to share this information. And, y'all, you kind of quid pro quo, y'all share the fact that we've got these Power Hour calls, and it may be something statewide that some of the workers in your healthcare centers would like to participate in. And with that, I'm going to turn it over to Sharon so she can talk about her extension, the Mississippi State Extension Minute, which is another group that has a lot of health educators out there that we should all try to coordinate better with so that we are, Sonja, getting the biggest bang for our buck.
Sandra, I want to thank you for allowing us, and I'm going to have to jump off and let us know if there's anything else we can do to help.
Thank you, Terrence. I really appreciate you.
Thank you.
And Sandra, I'm just going to give you a couple of facts about diabetes. Approximately 326,000 people in Mississippi, and that's about 14% of our adult population have diagnosed diabetes. An additional 75,000 people in Mississippi have diabetes but don't even know it. And then there are over 800,000 people in Mississippi that have been diagnosed with pre-diabetes. And this is why it's so important that we educate, and collaborate as well. But the Mississippi State Extension Service has a program called Dining with Diabetes that we offer to the community at no charge. There's an extension office in each of the counties. in Mississippi. So if you are interested in participating in that program, it is actually a 4-session program. And the sessions are living well with diabetes, learning about carbohydrates and sweeteners, learning about fats and sodium, and then about vitamins, minerals, and fiber, putting it all together to make it work for you so you can have a healthier lifestyle. And something else that Mrs. Shirley said, as well as Dr. Fuqua said, about making sure that we can provide preventive measures. So if you have been diagnosed with diabetes or you are pre-diabetic, you want to get the necessary education that you need so that you won't get the diabetes or prevent you from having some adverse effects from diabetes. So again, education is so important. So if you are interested in one of these programs, please don't hesitate to reach out to your county extension office. I am here in the Yazoo County. Our number here at the office is 662-746-2453. If there's an organization that's on the call that would like to partner to educate the community about the dangers of diabetes and how to prevent it, please don't hesitate to reach out. My name is Sharon Meadows. I'm the extension agent for Yazoo County. We have had another awesome power hour. At this time, before I make closing remarks, do we have any community announcements from any of our partners on the call?
I have a community announcement. This is Joyce Nunn again. We're still doing the COVID vaccination. We're promoting it. Like the federally qualified health centers, majority of them actually are offering the $50 for the first and second shot. And plus, also, you could find one of your community health workers that's in the area or whatever, and they're also promoting it, and they're giving a $25 gift card if you get the vaccination, either one of the first, the second, or the booster. So we're encouraging everybody to get out and get vaccinated. If you haven't gotten vaccinated or if you know of someone, please encourage them to do so. And because right now I got a text message this morning that there's a new variant that has hit China, but I can't really tell you much about it because I haven't went back out and researched it. But as soon as I do, I will let you know. But please get vaccinated.
Thank you, Joyce.
Hi, Sharon. This is Earlene Anderson, MTFT for LaFleur, Humphreys, and Kerr County. I wanted to ask one simple question. I noticed I've had a couple of calls to come in on the mental health issue. They were talking about someone. A man spoke about psychiatrists, and you can do it virtually. There's there's increasing numbers of depression, and that we're all hearing about. Is there a number? Because there are no psychiatrists, very few around. It's kind of difficult to get to them because the problem is so great. Can someone share the contact number, how you can refer someone, or what is that process for those that you see need something other than just normal counseling? They need to speak with a psychiatrist.
Sonia, can you help us out with that?
Yes, this is Sonia. I'm still on the line, and I'm sorry I don't have the answer to the question. However, the respective community health center, if the patient is at a community health center, may have a referral access. But, I don't know. It would depend on where they are being seen. But you are right. I know our health centers don't have a lot of providers that do that work, but even across the state of Mississippi, there's an access problem, even in the private sector.
Does the University of Mississippi Medical Center have any telehealth programs that are associated with mental health? Does anybody know?
They do.
Okay. Early, we'll see if we can track that down, and we can post it on our website, because I'm very interested in access to mental health care for, going forward with some of the initiatives that the partnership is looking at, especially with our youth.
Okay, I would like to make a suggestion on the mental health. situation in regards to the public. I currently work with seniors, and first of all, my name is Greta Winters, and that is a big issue for our seniors, especially in regards to isolation. But I have a wonderful program that I actually refer them to, which is called Senior Life Solutions. And they actually, at this time, they are meeting in person. They are practicing all the COVID precautions, and they are at the our local Baptist of Yezu Hospital. They actually have meetings. They can also come out, assess the client to see if they're appropriate for their program as far as mental health counseling, and they will transport them to and from the meetings. So that's just another resource I just wanted to put out there. And also a lot of the clinics, I know the one G.A. Carmichael here, they actually have a licensed social worker that can come out and also speak to persons who are experiencing mental health crisis in regards to COVID or any other crisis that they're having. So I just want to put that out. A lot of clinics in regards to the mental health situation, they do refer them to their licensed social workers who can help them or assist them with therapy or any type of mental health concerns that they may have.
Thank you, Greta. Any other community announcements? Any other comments? All right. Well, Sharon, you want to wrap us up?
We'll wrap us up. We've had another awesome partnership power hour. We thank our presenters, Mr. Shirley, Dr. Sonja. Thank you all so much for being a part of it. They are representatives from the Community Health Center Association. They have 21 health centers across the state located in 73 of our counties. They have even school-based clinics, and we are so excited, so proud of what you're doing for the individuals that are not insured as well as those individuals that are uninsured. And what I love about what you all said is you do not turn away anyone. So we thank you for what you do for the citizens in Mississippi. Continue the good work that you're doing in the community. If we can ever be of any assistance, please don't hesitate to reach out to Ms. Sandra or myself, Sharon Nettles, and we will do whatever we can to continue to get the word out. And again, please visit our webpage, our Facebook page, so that you can find out additional information. Sonja, if you would, give us your website one more time before we end the call.
CHCAMS.org. Community Health Association of Mississippi. Mm-hmm.
Awesome. Thank you so much. Again, you did a fabulous job. Again, tell Mr. Shirley he did an awesome job as well. Again, we thank you. Community partners, please do not keep this information to yourself. Please share this information with the individuals that you come in contact with on a daily basis, especially if they need it. A lot of times, the only time they find out about something is about word of mouth, and we don't want to keep this great information to ourselves. So if we come into some contact with someone that needs these services, please refer them to one of these clinics. Again, we thank you, community partners, for always joining us on a Tuesday from 10 to 11 o'clock. If you have additional information that you would like more information about, it could be this topic or another topic, please reach out to myself or reach out to Sandra, and we can get a program geared towards it, because we want to provide information that is beneficial to our community partners that so faithfully join us on a weekly basis. Again, we thank everyone for joining us. Please reach out to us if you have any questions, and please share this information about the Partnership Power Hour as well. When you get the reminder text messages, please forward them. When you get the constant contact emails, please forward them to your contacts as well. And again, we thank you all so much. Enjoy the rest of your day.